but like STDs questions. How do I spread STDs? Most importantly, herpes. Herpes is one of the the topics that I have to deal with and address every single day, because sometimes people have been diagnosed with herpes or have friends that have been diagnosed with herpes, but they don't have lesions and they don't know if they can have sex with other people. How does it spread? Does it shed when I don't have lesions? Am I a leper because I've been diagnosed with herpes once in my life, or I've been exposed to someone that was diagnosed with genital herpes? That's HSV2 or HSV1. These are all really, really heavy questions, right? And they're not simple answers that you can give patients. The most important thing is to educate patients on what safe sex means. That means, number one, if you're going to be sexually active with someone, you need to have a conversation about their sexual history. That's point blank. If you're going to be that vulnerable, if you're going to take all your clothes off, you need to ask someone, hey, when's the last time you were tested? Have you been diagnosed with anything? That should be a comfortable conversation. That should be topic number one rather than your tits look nice. Like, you know what I mean? Like, that should be topic number one, okay? So, like, that's the conversation, okay, that I try to encourage my females to have with their partners. And then outside of that, if you meet someone, you're in a relationship with someone, for instance, herpes, I'm gonna go back to that because it's a complex topic, but that has been diagnosed with herpes, so how do I not get it, right? So then you go into the education piece as providers. We have to educate and spend the time saying, herpes is something that a lot of people have been exposed to. There's HSV1, which is oral herpes, HSV2, which is usually genital herpes, and how do you prevent that from spreading? When you have a lesion, you use your common sense. You're not going to have unprotected intercourse. You're not going to, kiss in like mucus to mucus membranes. You're going to try to prevent that spread from happening until that lesion goes away. But if you've been diagnosed with herpes before, there are instances in which the virus can spread without the lesion. So that's pretty scary, right? Because people are like, well, if I don't have the lesion on my mouth or on my genitals, and I want to be in a relationship some point in my life, does that mean I can never have sex or kiss or share drinks or whatever the case may be with someone? No, that's not the case. So it's important about kind of like educating people about how you spread the virus, what the likelihood of spreading viruses when you have a lesion. When you don't have a lesion, you have to make sure that you're telling your partners, hey, I've been diagnosed with this in the past. So we're all on the same page, but also knowing that there's such a stigma behind these diagnoses, and with education and making responsible decisions as far as sharing your sexual health past with your new partners and the partners to come, that's where the good stuff lies, is having those open and honest conversations and kind of taking away that stigma and taking control and empowering yourself to be like, I know my sexual history, I know my partner's sexual history, and this is how we push forward. I think so many people are so afraid to ask, right? So many people are so afraid to even ask for STD testing at their physical. They think it's just like this scary thing, like I'm gonna judge them that they're sexually active. That's absolutely not the case. I ask every single female and male patient, whether they're married or not, do you want STD testing? Do you want it? That opens up the door. It's so simple, but it opens up the door to something that so many people cannot just bring up themselves. So the stigma of sexuality and what comes with that, unfortunately, is STDs, needs to be changed a little bit with conversation and education, especially with your providers, primary care providers, your sexual therapists, as well as your OBs. Just be open. Just ask us the question.
And I would say even more so that it's now the standard of care. You don't really have to ask. That everybody should be getting screened. And if your clinician is not talking about it, then it's time to start thinking about finding a new clinician, because it's a standard of care to offer people testing. I think that's really important. And I think it's important even more so about empowering women, and it's the messaging. It's okay, you know, if you look at the paradigm, you know, it's okay to talk about your penis at the Super Bowl, you know, on the commercial, on TV. Where are the ads for women? You know, where are the ads about, you know, we have a lot of medications that are available for women. I know because I work with some of these companies, and the only way that they can get a commercial on television is at 2 or 3 o'clock in the morning, because they don't want to offend anybody. But to say at a, you know, sustained erection at 6 o'clock right after the news is okay, because these are the messages that women are getting. Young girls are getting that it's okay for a man to be sexualized, but women are not. It's the same paradigm that I talk about when you see a 16-year-old boy going into a store to buy condoms. He's like very excited and takes the big box and slams it on the counter, hoping for a price check. And then the woman who wants to go in and buy lubricant because she's suffering from vaginal dryness, she's embarrassed. She puts 14 things in her cart, hides it underneath, prays for no price check. So it's the messaging that women are very often given and perceived, and sometimes it's perpetuated by clinicians who are not very sexually aware. We don't prioritize talking about sexuality in medical school, in residency training. It's very rare. So I spend a lot of time educating other clinicians and educating the public. But I think it's important for women to be empowered and find the right clinician that serves your needs. So I think it's very important that sometimes your clinician doesn't know what the right words to say. There's barriers on both sides, right? Clinicians kind of, I say it's a conspiracy of silence, because patients will say, you know, if sex was important, my doctor or nurse practitioner would bring it up. And then the doctor says, you know, I don't want to embarrass them, and you know, if they have sex concerns, they'll bring it up in the visit. So both people really want to talk about it, but no one is really breaking the silence. And I think it's important to just normalize it. You know, I think it's very important that if your clinician isn't offering it or doesn't have information about painful sex or changes in libido, you need to start finding clinicians that are going to be willing to talk about it with you.
So one thing I wanted to add to Dr. Krychman's response when he was talking about media, not social media, but TV, is that I don't think you can say vagina on TV, right? Isn't that so?
What?
Yes, you cannot say vagina on TV. So they bleep that out, which is, yeah, but you can say erections, and you can say, I think, penis, and you can say, but yeah, exactly. So they worked around it. So it's the vajayjay, it's other words that they've used to put in place for vagina. And then going along Dr. Benitez's response about just discussing and having that conversation about STDs. If the doctor is not bringing it up, it is so important for you guys to bring it up. And there's so many articles that have been written about patients' hesitation to talk about sex, and they want their providers to do it. But if their providers aren't doing it, then it is up to the patient to bring it up. And it's unfortunate, and there's a lot of things that doctors do very well, but in terms of sexual issues, that's not necessarily the case. So if you are having pain with sex, or if you want to have, you know, how do I have a conversation with my partner about STDs or getting checked or things like that, then really it's so important to bring it up to your doctor or nurse practitioner or the provider that you're seeing.